Well, thank you very, very much. And good afternoon, ladies and gentlemen. Bon après-midi, mesdames et messieurs. I just want to talk briefly on 3 or 4 quick items before we hand it back to Dr. Etches. First is the new enforcement measures. We need to, here in the City of Ottawa, continue to keep residents safe and do everything we can to slow the spread of COVID-19. Nous devons assurer la santé et le bien-être de nos résidents en ce temps d'incertitude. That's why Ottawa bylaw officers have now been given the ability by the province of Ontario to enforce new rules under the Ontario Emergency Management and Civil Protection Act related to physical distancing. This means that effective immediately, a dedicated team of officers at Bylaw and Regulatory Services will be proactively monitoring and enforcing calls related to gatherings of more than 5 people in public or private residences, people congregating in parks using park facilities or equipment, restaurants that continue to offer dine-in services, and non-essential retail businesses continuing to operate. Residents who witness these issues should report them by calling 311. Bylaw officers will be taking a progressive enforcement approach with the initial goal to educate residents and businesses about these laws and their importance to public health. As time goes on, failure to comply could result in fines under the Provincial Act of up to $100,000 for individuals, $500,000 for a director of a corporation, or $10 million for a corporation itself. Bylaw and Regulatory Services continues to collaborate with the Ottawa Police Service, which will continue to enforce calls related to quarantine orders issued to individuals who have been traveling or who are experiencing symptoms related to COVID-19. Complaints related to the Quarantine Act should be reported to the non-urgent Ottawa Police phone line at 613-236-1222. Alors, en français, le numéro pour la police non urgent, 613-236-1222. The second item is a quick update on our economic task force. Our task force met today via conference call. As you know, this is made up of business groups and tourism and hospitality leaders in our community. And Councillors El Shantiri and Councillor Dudas sit on that task force. One of the key messages that came out of the task force today is obviously in the next 2 days we come to the end of the month or the beginning of the month, of the new month, and rent will be due for many small and medium-sized businesses. The task force, and myself included, are urging landlords to please be reasonable, flexible, and ensure that you have a dialogue with your tenants, because the last thing we want to see are businesses going out of business because they're not able to pay their rent. We recognize that landlords have expenses as well, but we think this is the time for compromise to ensure that there is ample opportunity for the small business who really has been without revenue for the last 3 weeks. And we have done our part by deferring the property tax payment, certainly the first phase to mid-April of this year, and then on a demand basis, on a needs basis, by application, people will be able to apply to have the property taxes deferred until October. So this is an important issue. I urge landlords to be reasonable and do their very, very best to accommodate those men and women who are struggling with basically no income as a result of COVID-19. The second task force meeting we had today was our Human Needs Task Force. There's been some concern in the social services sector that, in fact, the funding for various programs under the city's watch would not be available. I'm here to assure those people in our social service partners there will be no cuts to their budget allocation. And in fact, we're now administrating $1.64 million in additional funding from the federal government that is going to our social service partners, Aboriginal organizations, shelters, and other community groups to help with increased costs of everything from cleaning supplies to protective equipment to transportation costs. Excuse me. The final item I'd like to bring the public and the media up to date is the 2020 spring flooding situation. In addition to the COVID-19 pandemic, we're now facing the 2020 spring freshet. Many of Ottawa residents awoke today with renewed concerns for potential flooding given the heavy weekend rains. Plusieurs résidents d'Ottawa se sont réveillés ce matin avec les préoccupations renouvelées face à la possibilité des inondations suite à la pluie qui est tombée en fin de semaine. Staff has advised me that water levels are not currently at threatening levels. Later today, I'll be issuing a memo to Council saying that I've asked Councillor Eli El-Shantiri to play a leadership role as the Council liaison on the 2020 Spring Freshet, as I will be preoccupied most of my time with COVID-19. Councillor El-Shantiri has been the front and center in helping our local communities rebuild after the devastating floods of 2017 and 2019. And some of you may recall that Councillor El-Shantiri was helping his friends and neighbors sandbag their properties while his family was losing a property to the flooding. J'apprécie grandement le dévouement du conseiller. Merci, Eli. And Councillor El-Shantiri will work closely with members of Council whose wards have been most severely impacted in the past, including Councillor Teresa Cavanaugh in Bay Ward and Councillor George DeRuse, who will be taking ownership and leadership in the Cumberland area as a result of the council seat vacancy, and he's managing that for us. I want to thank Councillor El-Shantiri for liaising with the City Senior Leadership Team, my office, members of Council, and key community agencies over the course of the coming days, and until such time as the 2020 spring flood threat is behind us. This is obviously an exceptionally challenging time for our city and our residents, and I want to thank the Councillor and all members of Council for working together as we focus on mobilizing the spirit and resources our communities need to overcome these challenges. The final item, I apologize on one more item, I did tweet out about this, that our Emergency Operations Centre has mobilized a donated material management unit. It was established because we've received an outpouring of offers of support from residents in the business community to assist with COVID-19 responses. All offers of support are appreciated. However, as you can imagine, in order to ensure the health and safety of our frontline workers, the unit will only accept donations of commercial-grade equipment in their original packaging. The unit will not, for instance, accept homemade personal protective equipment. The list of the types of things that are required are on my Twitter account, and the information email is donations@ottawa.ca. Alors, communiqué dans les deux langues officielles dans mon site Twitter et le courrier électronique est donations@ottawa.ca. So thank you, and I'll hand it back to the moderator. Merci.
Thank you very much, Mayor Jim Watson. Just a reminder for those attending the call, please place your calls on mute, and at any point during the teleconference, please do not place us on hold. We want to avoid any hold music today as well. So at this time, I invite Chair Eagle to say a few words.
Thank you, and good afternoon. I appreciate the opportunity to address the public during these very trying times, and I thank the media for assisting OPH in getting important messages delivered. I want to take this opportunity to recognize all the hard work that OPH staff and all healthcare providers are putting in as our first line of defense against COVID-19. The challenge is a significant one, but there are simple things we can all do to assist in the fight. First and foremost, stay informed so you can stay on top of your personal health situation. The best way to do this is to check the OPH website regularly, ottawapublichealth.ca. Secondly, practice physical distancing. This means no unnecessary trips out of the home and no public gatherings. Thirdly, during these difficult times, treat your friends and neighbors with kindness and compassion. Reach out virtually to check up on one another. Look after one another. Let's stick together by staying apart. Merci.
Thank you very much, Chair Eagle. At this time, I invite Dr. Etches to say a few words.
Merci. As of this morning, there are 130 confirmed cases of COVID-19 in Ottawa. That's 8 new reported cases since yesterday. And you might have noticed that the Ministry of Health has changed the way it's reporting case data. We also understand that going forward, the Ministry of Health is going to provide more information on cases across Ontario at 10:30 in the morning daily, based on results available as of 4 p.m. the day before. So as the number of cases grows, the Ottawa Public Health Team is also adjusting how we collect and track data, and we're working to update our reporting strategy online to align with the ministry reporting. We now have outbreaks in 2 retirement homes in Ottawa, with 5 cases in one outbreak, and counts are pending for the other. As I reported to you last week, the first retirement home outbreak was at Orleans Promenade, and the second one is at Maplewood Retirement Community. Depuis ce matin, il y a 130 cas confirmés à Ottawa. Cela fait 8 nouveaux cas depuis hier. Nous avons aussi des éclosions dans 2 maisons de retraite à Ottawa, avec 5 cas dans une éclosion et le nombre de cas à être confirmés dans l'autre. Sadly, we've also had our second COVID-related death in Ottawa, and this is the first from a retirement home setting. Malheureusement, nous avons eu notre deuxième décès à Ottawa lié à la COVID-19. Il s'agit du premier dans une maison de retraite. With respect to retirement homes, Ottawa Public Health continues to investigate and support both the homes with their outbreak management measures. Ottawa Public Health is connecting with close contacts, as we do in all cases. En ce qui concerne les maisons de retraite, SPO continue d'enquêter et d'appuyer les 2 maisons dans leurs mesures de gestion des éclosions. Santé publique Ottawa prend contact avec des contacts étroits, comme nous le faisons dans tous les cas. The number of people hospitalized has increased. There are now 21 people in hospital, 21 dans les hôpitaux, et 6 sont dans les soins intensifs. 6 are in intensive care units. We also now, on a positive note, have 10 resolved cases to report. I mentioned announcements continue, or I usually say that we keep hearing announcements from the provincial and federal governments. So just to highlight that, yesterday the provincial government indicated that there's a limit now of 5 people that can gather, with exceptions for private households, child care centers supporting frontline healthcare workers and first responders, and funerals, which are permitted to proceed with up to 10 people at one time. And earlier today, Ontario's Chief Medical Officer of Health, Dr. David Williams, issued a statement calling on Ontarians to do more to combat the spread of COVID-19, noting that opting out is not an option. He strongly recommended that all residents stay home except for essential reasons, such as to access healthcare services, shop for groceries, pick up medication at a pharmacy, walk pets when required, and support vulnerable community members with meeting these needs. So given the greater risk of severe outcomes to Ontarians who are elderly, he also strongly recommended that individuals over 70 years of age self-isolate. And this also applies to individuals who have compromised immune systems or underlying medical conditions. We recognize that this physical distancing and self-isolation is hard. People may feel disconnected. They may experience difficulties in managing stress or anxiety. And we know for some that home is not a safe place. So we're pleased to see yesterday's announcement by the federal government for funding for Kids Help Phone and New Horizons for seniors through the United Way. If you're struggling, please reach out. The OttawaPublicHealth.ca website has a list of mental health resources available in our community, and the Ottawa Distress Centre is available for people needing more support. I also want to reinforce that anyone who's not experiencing signs of illness and who is not subject to self-isolation under the Quarantine Act should try to get outside for fresh air and exercise in order to maintain health during these difficult times. When doing so, please remember to practice physical distancing. That means staying 2 meters away from anyone you encounter during your walk. Passing someone on a sidewalk is not considered a high-risk activity for infection with COVID-19. Thank you again. Merci pour votre patience et partager notre information. Veuillez continuer à visiter santépubliqueottawa.ca/coronavirus. Merci.
Thank you, Dr. Etches. At this time, I invite Dr. Willmore to say a few words.
Thank you. The COVID-19 Assessment Center at the Brew Arena is continuing to take pressure off emergency departments in the city. So to date, over 5,000 patients have been assessed at the center who otherwise would have had to go to an emergency department. And of those that have been assessed, 87% were swabbed. If you're waiting at home for your results...
Alexandre Duval.
if you're waiting at home for your results after being tested for COVID-19 and you begin to experience shortness of breath or chest pain, please go to the nearest emergency department or call 911. And please continue to use the emergency department for any non-COVID related medical emergencies. We are ready and able to help anyone in need. Nos services d'urgence sont prêts à vous accueillir s'il faut des soins urgents. La mise en place du centre d'évaluation pour la COVID-19 a permis de soulager la pression sur les urgences. Alors, si vous avez besoin de soins médicaux urgents, n'hésitez pas d'aller à la salle d'urgence la plus proche. Si vous attendez vos résultats de dépistage de la COVID-19 et que vos symptômes s'aggravent, par exemple essoufflement, douleur à la poitrine, allez à la salle d'urgence la plus proche ou appelez le 911. We are aware that there is a backlog of in-processing tests in Ontario. All swab analysis was sent to a centralized lab for processing prior to March 23rd. A dedicated team is working to get those results back from the central lab for residents in Eastern Ontario. Last week, the Eastern Ontario Regional Lab Association began COVID-19 testing locally and has made significant progress to increase our regional test capacity. I want to thank everyone waiting for their patience, and in the meantime, please do not seek retesting or call the centralized public health lab in Toronto for results, as they're unable to release these results to individuals. Patients who are assessed at the assessment center at Brewer Arena will be contacted by telephone by clinical staff from the Ottawa Hospital or CHEO. Our community has stepped forward, like many others across the province, and we're receiving donations of supplies from people in healthcare, education, technology sectors, and the construction industry. We're grateful for the community support, and in response to the donation offers, we've created an email, coviddonations@toh.ca, which is where the community can send their offers. Gowns, masks, gloves, face shields, disinfectant wipes, and hand sanitizer are all welcome. And it's important to note that this is a regional supply across the Champlain region. I can also provide an update on the care clinics in the community. These care clinics will be ready to open quickly when needed to support our healthcare system. And this is a collaboration between the Queensway Carleton Hospital and Hôpital Montfort, supported by our regional partners. These care clinics are specifically designed to absorb an increased volume of patients with febrile respiratory illness. This is to offload emergency departments and family doctors' offices, and they will be able to provide diagnostics as well as care. And we hope to deflect these patients from emergency departments while at the same time providing a high standard of care. And finally, I can report that at the request of the province and along with other Ontario hospitals, we are now reporting our PPE inventory to the province. Thank you.
Thank you very much, Dr. Willmore. We'll now take questions from the media. Just a reminder that we'll be taking one question and one follow-up per agency and not per reporter. So please coordinate accordingly with your colleagues. 104.7.
Oui, pour une première question qui s'adresse au maire Watson. Vous avez reporté le premier paiement de taxes d'environ 3 semaines. Est-ce qu'il va y avoir d'autres mesures économiques pour les propriétaires de condos, de maisons ou d'immeubles à logement?
Oui, on a annoncé à la même temps la possibilité pour des résidents et des landlords comment on dit, delay payment de leurs taxes jusqu'à le mois d'octobre, parce que la prochaine étape pour payer les impôts, c'est juin, et on va annoncer des détails pour une application pour faire un paiement pas à juin, mais dans le mois d'octobre pour aider les petites entreprises et des résidents de la ville d'Ottawa.
Sous question, Monsieur le maire, il y a beaucoup de policiers qui vont être appelés à travailler sur le terrain avec la nouvelle directive du gouvernement du Québec de rassemblement de 5 personnes. Allez-vous aller chercher des policiers qui n'ont pas tout à fait complété leur cours ou qui sont sur le point d'avoir complété pour aider sur le terrain?
Non, ce n'est pas une situation possible. C'est nécessaire pour tous les policiers de terminer leur cours et les examens. Mais ça, c'est la raison qu'aujourd'hui, j'ai annoncé que les agents de règlement de la Ville d'Ottawa avaient des nouveaux pouvoirs pour aider la police avec les activités, par exemple, un groupe de plus de 5 personnes ou un groupe qui est dans un parc qui n'est pas acceptable. Alors, notre bylaw officers, comme on dit en anglais, est maintenant capable de faire plus de travail pour aider avec les pressions de la département de police.
Merci, Monsieur le maire.
Just a reminder, please put your phones on mute as you're on standby, but now we'll hear from 1310.
Yes, hi. We've now seen 2 outbreaks at retirement homes, including the city's second death. Is it time to place all retirement homes in a lockdown?
This is Vera. I'll respond to that, and if Dr. Willmore wants to add anything, please do. So retirement homes and long-term care homes have been implementing measures for a number of weeks now, including limiting visitors, restricting, actually
Mathieu Loca, Cogeco Nouvelles, 147.
Prohibiting visitors and screening everyone who enters the building. So when a facility is in outbreak, what we're asking the buildings to do is to make sure that across the whole facility, regardless of even if just one part of the facility is affected, to make sure the whole facility is using droplet precautions, that every single resident is isolated. Of course, the dining room and all activities are ended. As well, staff need to wear a mask when entering the building and use droplet and contact precautions for every resident the entire time that they're in the building. We're also making sure that employees work only at one facility. So there are a number of measures that are in place when there is an outbreak, and also to prevent outbreaks. I don't know, Dr. Willmore, if you want to add anything?
Actually, that was very well summarized. Thanks, Dr. Etches.
Thank you. We'll go follow up from 1310.
Yeah, you said you want employees to work at one facility, but there are instances where there are employees that work at multiple facilities. Are you worried that that takes away some of the ability to be able to take care of some, employees in one facility compared to another?
Dr. Willmore, I think you're addressing staffing through the long-term care table? Yes.
I'm sorry, could you repeat the question? I apologize.
Oh, yeah, no problem, doctor. So you mentioned that we want employees to be able to work from one facility, but there are instances where a healthcare worker, works part-time in 2 different facilities. Is there a worry in this case?
In terms of them working at more than one facility? Well, if we're looking at an infectious disease situation such as COVID-19, it highlights the need for self-monitoring and also for screening at the hospitals. So in order to mitigate the potential of having a staff member inadvertently contaminate another facility, we have very strict guidelines that are being rolled out throughout the region to ensure that we are keeping on top of it. So we ask our staff that if they have any symptoms, they stay home. And if they do not have symptoms, there is a universal mask policy that's being rolled out that will further mitigate that potential threat.
Thank you. Over to CBC.
Yes, hi, it's Kate Porter. Wondering, this is a question either for Mr. Demonte or the mayor, but if you could expand a bit about the bylaw increased, you said being more proactive. Like, what does that look like? I guess you're getting a certain number of complaints about people gathering. I mean, will there be a sense of, okay, we'll go look at parties versus, say, extra family members being in the house? I just wonder if you could tell us a bit more about what that will look like.
Mayor, if you wish, I can answer.
Yeah, go ahead, Tony.
Thank you. Well, Kate, in essence, this new authority to bylaw officers, when the Emergency Management Act was put in place, it was only peace officers that were allowed to enforce it. So now these new tools. So we've worked with Ottawa Police to basically divide the work. And so in practical terms, as the Mayor indicated, gathering of more than 5 people in public or private residences. Obviously, in private residences, it doesn't apply to family members, but we're talking about people deciding to have parties in private residences, so we'd intervene there. Congregating in parks and facilities, restaurants that continue to use dine-in services, or non-essential businesses that haven't been identified that continue to operate. So in all those cases, how will it look? When we receive calls, and we have had, Kate, we've received on the weekend, on Sunday, I think we had about 50 different calls that we were responding to. We'll intervene. Education will be our first approach, and explain to people why they shouldn't do that from a public health perspective and what their responsibilities are. And then if that doesn't work, there are tools now that under the Provincial Act for individuals, for corporations, for individual corporate directors as well too, and they can get initially they're not as severe, so an individual can be $750 fine, which is fair fine, but can be up to $100,000. But so in essence, our objective here is to give regulatory and enforcement support to the activities that our public health experts are telling us to stay home and to create physical distancing. It's a coercive tool that we don't want to use, and we start with education, but it's a tool that's necessary, and the government has deemed it required to give us those powers now.
Est-ce qu'on peut l'avoir en français, s'il vous plaît, cette réponse?
Oui, Mary, you want to answer? I'll answer in French.
Vous continuez en français, après ça, je vais donner un autre.
Parfait. Essentiellement, le gouvernement, lorsqu'ils ont déclaré la loi des mesures d'urgence, la capacité d'intervention demeurait seulement au niveau policier. Ils ont modifié la loi maintenant que les agents de règlement municipaux peuvent intervenir. Votre collègue m'a demandé la question, qu'est-ce que ça va représenter? Nous, ce qu'on va faire, c'est qu'on va intervenir par rapport plus que des activités avec plus que 5 personnes, des gens qui peuvent être dans les parcs, dans grands groupes, les restaurants qui continuent à offrir des services qu'on peut déjeuner ou être dans le restaurant intérieur qui est pas approprié, et les entreprises continuent à fonctionner qui ne sont pas désignées essentielles. La première intervention sera d'éducation, et deuxièmement, on a maintenant des outils qu'on peut avoir des fines, voyons. On peut intervenir au niveau de comportement en termes de donner des contraventions. Des contraventions aux individus et aux corporations. Donc, notre objectif est l'objectif santé publique, que ces activités-là ne se comportent pas. On a maintenant des outils réglementaires pour intervenir, et on va commencer par l'éducation, et si ça ne fonctionne pas, on peut passer à la contravention.
Sorry, if I could just offer a comment. Folks, we just had our second death in Ottawa, and it is completely irresponsible when I get reports back that people are having house parties or porch parties, and they're pouring out onto the street. This is a serious epidemic, and we need the tools that the province has given us so that we can let these people know that it's not only illegal, it's idiotic to be holding a house party in the midst of a pandemic, and also, at the same time, these people who are gathering in parks. The parks are closed except to walk through them, not to gather, not to use the playground equipment. And I think parents also have to take responsibility. Where are your kids? They shouldn't be out there in groups of more than 5 hanging around a park, because we're trying to stem the tide of this horrific disease. So I applaud the provincial government for giving our bylaw officers that additional authority so that it takes some of the pressure off the police.
Let's loop back to CBC for a follow-up question now.
This is not quite my follow-up. I just wanted to make sure I heard Mr. DeMonte correctly, that you dealt with 50 complaints?
Yeah, on the weekend, yes, we had 50 complaints that came in through different sources, indicating parties, people, and more importantly, peoples in parks, as the mayor just mentioned, gathering in groups and doing activities. So again, our public health experts are telling us we have to stop this if we want to flatten this curve. So we intervene on the weekend. The authorities were given to us March 27th by the Solicitor General and Minister of Municipal Affairs under ministerial direction, but we've just finalized with Ottawa Police how we're going to work this out. So operationally, we can be the most effective and efficient in both services, and Ottawa Police will continue to assist if it passes the fine level, and they will continue to do the quarantine orders working with Border Services Canada. So that's how we split up the responsibilities, and we believe that'll be very effective from an enforcement standpoint, but more importantly, people should be heeding what our public health officials are telling us.
Thank you. Unfortunately, due to time, I'm going to have to treat that as the follow-up, but we'll try to loop back. We'll go to CTV next.
Okay, thank you.
Good afternoon. Good afternoon, Dr. Etches. There's been a lot of conflicting comments over the weekend about who should be wearing face masks when they go out. Can you sort of say who should be wearing a mask if they go to the grocery store or go out, and who shouldn't be?
Yes, I can speak to the use of masks. It's actually not simple because I think it's been confused by the previous, conversation about masks in general, their use in the public, not being clear that that was effective to prevent someone from becoming infected. Now we're looking at a situation where the question is, could those masks being worn by the general population protect others by making sure that the person wearing the mask is keeping their respiratory secretions to themselves. And there isn't a lot of evidence for that either. So, certainly, we need healthcare workers to be wearing appropriate masks, approved masks. There's a shortage of supply for the general population, and we see that people are making their own masks. And, if people want to do that and cover their face, then I'm not going to stop people from doing that. Just want to remind people that there are ways to take on and off a mask that keep yourself from getting contaminated, that you want to wash your hands before and after. Masks can become dirty while wearing them. So I think that, this is an active question. We're looking for more evidence-based guidance, and we understand, that is something that people are doing and appreciate that. There isn't a recommendation available right now, but for those who are ill going to get health care, that is clear. We do want people who are sick to wear a mask. So if you have a cough or a fever, when you go out, you should be wearing a mask. When you're going to get health care, you should otherwise be self-isolating. If you're going to care for somebody else, then there's also a recommendation that you might have added protection from wearing a mask. But we do know that this is a situation where not everyone can access masks, and we need to prioritize them for healthcare workers as well.
To follow up from CTV?
Audrey Roy, Radio-Canada.
Now with the city sort of launching bylaw officers to look after complaints, and the province's medical officer of health recommending today that people should limit their trips outside, do you still feel it's okay if people want to go outside for a walk or something like that to get some fresh air if they're not under quarantine?
That's correct. There's been clarification from the federal government since March 25th when they issued a quarantine order that people should not leave their property in the 14 days following travel. But for others, as long as you're not sick, if you don't have a fever and a cough and you're feeling well, then yes, that is still a useful thing to do to help us, manage the stress and get through this, to be able to go out for a walk, maintaining 2 meters from others when you're out.
Let's go over to Le Droit maintenant.
Oui, on a appris malheureusement le deuxième décès d'une personne qui avait été d'un cas qu'on a découvert à la résidence Promenade Orléans la semaine dernière. Vous nous avez aussi dit que 5 cas confirmés dans une des 2 résidences, que ce soit, c'est dans laquelle exactement, dans Promenade Orléans ou Maplewood?
Les 5 cas sont pour la maison Promenade. Le Orléans Promenade, ça c'est l'éclosion avec 5 cas. OK.
Donc, après qu'on ait découvert je crois que c'était 2 cas, dans le fond, un couple vendredi dernier, on a fait des tests dans les autres chez les autres résidents, puis c'est là qu'on a découvert les cas, où il y a des membres du personnel là-dedans.
Je n'ai pas les détails, mais c'est important avec une éclosion de trouver les gens avec les symptômes et si c'est un travailleur, de faire un dépistage. Quelquefois, dans une éclosion, on ne fait pas le dépistage pour tous les gens parce qu'on connaît que c'est le virus qui est là, qui est la cause. Mais je ne sais pas exactement qui est le nombre, la catégorie de personnes qui ont eu un dépistage dans cette éclosion. Mais on fait le suivi avec tous les contacts proches, étroits. Et aussi, on a des mesures pour chaque personne dans les maisons parce que c'est un peu plus protectif pour chaque personne dans la maison.
Okay. Yeah, Ottawa citizen.
Yes, thanks. I'm trying.
Fennell, CTV.
Hi. I'm just trying to get a little more information at the long-term care retirement homes. And I know you probably went over this in French, but you said there were 5 cases at Orleans Promenade, which means Maplewood has no confirmed. They're all pending. Is that right?
No, I'm just not sure of the status. That investigation is just beginning, and I'm not sure which number of people have symptoms in that home yet. The team, I believe, would have 1 confirmed case, or they wouldn't call it an outbreak due to COVID-19. But it's a question of the others that are being tested, or the others that have symptoms. I don't have that specific number yet.
So just so I'm clear then, so there have been 5 confirmed residents or residents and staff at Promenade?
I don't have that information. I can see you're interested in that. I can try to provide that tomorrow.
Okay, because we're being told that only 3 people are being tested per one of these institutions, and then you call it an outbreak based on that. So I'm trying to find out.
Yeah, it's possible. It's possible that there are healthcare workers being tested. There may be more rationale to test the healthcare workers so that they can keep working if it's a negative for COVID.
Okay, I guess just to get, so I have a better sense of this. One is, also, you may have just said this, but was the death from the Orleans residents?
Yes, that's correct.
And a man or a woman? Do you have details on that?
No, I think we're not speaking about more details that might identify someone.
Okay, but just
Yeah, I'm gonna have to take that as the follow-up question, and we could follow up with a written response for further questions, just due to time.
Thanks.
But we'll go over to Global.
Hi. My first question is for Mayor Watson. I noticed your tone seems to be hardening a bit there with your comment on how it's irresponsible now to be gathering in large groups, and I think you used the word even idiotic. Are you getting complaints personally about gatherings? I'm just wondering, is your patience running out with how residents are conducting themselves?
Well, look, the vast majority of people are respecting the law and being good citizens, but you have a small group of people, and as we saw over the weekend, 50 specific complaints came in from across the city where people are having house parties, gathering in large numbers in parks, playing basketball, climbing over fences in Barhaven to kick around a soccer ball with 10 or 12 of their buddies. This is not acceptable. This is not only going to be harmful potentially to the individuals who are breaking the law, but they'll bring it back to their household or their family's and friends' household and continue the spread. The numbers are going up, they're not going down, and we have to all respect the fact that, yes, it's terribly boring sitting at home watching, old bad movies on Netflix, but it's the way we're going to get through this. And there is a sense of frustration, I think, on the part of all first responders and civic officials and health officials, that people have to understand that this is not some practice or a drill. This is the real thing. People are dying. We've seen our second death, sadly, in our city, and the number of people, well over 100 now, that have been inflicted with this virus. So my message is to families, make sure that you teach your children and everyone else in your household that this is the time to respect the law and not flaunt it.
Follow-up for Global?
Yes, for Dr. Etches, previously you told us that the patients in the ICU were predominantly in their 50s and 60s with someone in their 70s. I'm wondering if that's still the case, or are we seeing any younger patients in the hospital or in intensive care?
I don't have the ages of people today. My sense is that these are still a similar population. I haven't been told that there's been a shift. I'm not sure, Dr. Willmore, if you can comment on what people are seeing in the ICUs.
I don't have that information at this time, but I can make it available.
Thank you. Over maintenant pour Radio-Canada.
Oui, ma collègue Audrey Roy a dû partir, donc Jérémy Bergeron qui va poser les questions. Mais d'abord, avant ma première question, juste un problème de traduction. Là, j'ai peut-être mal entendu. Là. Vous n'êtes pas en mesure de donner des détails par rapport au décès, hein, l'âge, tout ça. Vous avez dit que vous ne pouvez pas rien dire.
Le problème avec traduction, c'est quoi?
Non, j'ai juste mal entendu en anglais, mais je veux juste confirmer que vous avez dit que vous ne pouvez pas donner de détails par rapport à l'âge et le sexe de... Vous confirmez,
oui,
on ne peut rien dire?
Oui, nous n'avons pas les âges pour les personnes dans les soins intensifs, mais je n'ai pas entendu qu'il y a un changement dans le type de cas là, et j'imagine que ça continue d'être les gens qui ont plus de 50 ans.
Parfait. Donc, ma première question, c'était les résidents de Maplewood pouvaient encore manger samedi ensemble. Est-ce que vous croyez que ce serait une bonne idée de restreindre les regroupements dans les salles communes après cette éclosion?
Non, c'est pas acceptable de manger ensemble quand il y a une éclosion. C'est une mesure que nous avons mise en place d'avoir les repas dans les salles pour chaque personne dans les maisons.
Okay.
Parfait. Ma deuxième question était plutôt au maire Watson. C'est quoi le message que vous voulez lancer aux résidents qui font encore des rassemblements, là?
Bien, certainement, le message est vraiment clair. Respecter la loi du Canada et la loi de l'Ontario. Ce n'est pas une bonne idée de aller avec 6 ou 10 amis pour jouer dans les rues ou dans les parcs. C'est illégal et c'est nécessaire de quitter cette activité et respecter la loi pour protéger les vies dans la ville d'Ottawa.
Merci. Maintenant pour TVA.
Oui, bonjour. Vous m'entendez? Oui, la première question serait pour le maire Watson. L'appel à tous lancé par communiqué pour des dons, est-ce que c'est parce qu'il manque d'équipement présentement ou sinon, quels sont les inventaires? Est-ce qu'il nous en reste pour quand même un bon bout?
Bien, peut-être Tony Demante va donner plus de détails, mais certainement, on a reçu beaucoup des offres. C'est très, très gentil de la population de donner leur appui à ce moment très difficile. Certainement, on avait toujours besoin des N95 masques, des gants et des choses comme ça. Mais Tony, peut-être tu vas donner des exemplaires plus spécifiques.
Oui, Monsieur le maire, vous l'avez bien dit. On reçoit beaucoup de demandes ou d'offres du public. Donc, on a concentré en ayant un numéro unique pour toutes ces demandes-là, qu'on peut les recevoir. Et peut-être que ce ne sera pas seulement pour la ville. Les hôpitaux font la même demande. Peut-être ces équipements-là sont dirigés vers les hôpitaux et d'autres types d'organisations. Donc, c'était juste un moyen de coordonner l'ensemble de ces offres-là à une place unique. On a créé un numéro unique.
Est-ce que vous pouvez rassurer la population comme quoi il y a suffisamment d'équipements pour l'instant? Ce n'est pas parce qu'il y a un manque potentiel?
Bien, comme le maire a indiqué, on voit l'évolution. On a des équipements, on a des stocks. C'est sûr qu'on va être en pénurie éventuellement si ça continue. Par contre, le gouvernement de l'Ontario nous a indiqué, et maintenant, au niveau de l'ensemble du secteur de la santé, on rapporte chaque jour nos stocks. Et donc, il y a une coordination qui se fait au niveau provincial pour être sûr que chacun des endroits géographiques de la province reçoit les stocks nécessaires. Donc, pour l'instant, on est correct, mais faut continuer à recevoir. On n'a pas encore reçu, mais il y a une coordination qui se fait maintenant avec la province et chaque établissement de santé, service de santé et service d'urgence paramédic est maintenant obligé de rapporter chaque jour nos stocks à la province qui coordonne globalement pour assurer qu'il n'y a pas de pénurie à travers la province et prioriser les endroits.
Merci beaucoup. Your community voice.
Yes, I'd like to go back to the retirement home issue. So we have 5 confirmed residents at or people at the Orleans Promenade. Are family members allowed to visit their parents in one of these homes?
No, they are not. There are no visitors, and I know that this is a challenge. However, I think there is grounds for compassionate purposes. If someone is very near the end of their life, I think that there are exceptions made for compassionate reasons.
Then is the only conclusion that staff brought this into the homes?
It's hard to know. The cases that we see today are cases that, could have resulted from infection a number of weeks ago when there potentially was more in and out. There are different kinds of people that visit retirement homes for other purposes as opposed to just the care staff. So it is difficult to exactly pinpoint the source. But that is why, the strict visitor protocols are in place, and everyone now coming in needs to be screened for whether or not they are ill, they have symptoms, and everyone coming into the home needs to wear a mask from the time they enter the home until they leave the home.
So thank you. This is all the time we have for today.